Welcome back to Alive and Well's Daily Dose, your daily dose of support. And today we're going to be talking about an important topic of supporting caregivers with children. Now, we know that there's a lot of stress and anxiety and uncertainty going on in this time. And we know that our caregivers who support children are then faced with increased amounts of responsibilities during this time. So we want to make sure that those caregivers are receiving that support, recognizing that you have that additional responsibility of nurturing and looking out for the well being of your children. So, with that in mind, we have two very special guests with us to talk about how we can support our caregivers. So, today we have a few therapists here with us that are from the Children's Advocacy Services of Greater St. Louis. We have Kiera joining us, and Kiera provides both short and long-term focused therapy, trauma therapy for children and adolescents in St. Louis City and County. And she facilitates a weekly psychoeducational group called TASK, which is Trauma Assessment Skills and Knowledge, that really equips caregivers of children impacted by trauma with this awareness and the strategies to decrease child and family traumatic stress. And one of her specific areas of interest is really those social cultural factors influencing trauma symptoms and recovery amongst Black youth. We're also joined by Alejandra, and Alejandra is a bilingual therapist, also with the Children's Advocacy Services of Greater St. Louis. And she utilizes really evidence-based modalities such as TFCBT, as well as integrative trauma treatment of complex trauma for children and adolescents to provide both individual and group therapy services across St. Louis. Now, she also facilitates some school-based programs, one being cognitive behavioral intervention for trauma in schools, as well as the psychoeducational group that we talked about earlier, trauma assessment skills and knowledge. And one of her areas of interest is really providing bilingual, culturally competent services to the Latino migrant communities. So I have to say thank you both for joining us this morning, as we're really going to talk about supporting caregivers who support children in our community.
Yeah.
And so I really want to turn it over to you both at this time, because I know you're going to share not just what's going on, but also really thinking about how we can be more compassionate with ourselves, as well as tools we can integrate to make sure we're supporting our children.
Well, thank you so much for having us, Sean. We are so happy to be here. As you mentioned, we do facilitate a weekly parenting group called TASK. And so supporting our caregivers, especially during this time, is very important to both Alejandra and I. So we are so appreciative to have this moment with you all. And thanks for tuning in.
Absolutely.
So we're going to be starting off today really talking a lot about, first of all, validating that COVID-19 has presented some very unique stressors for us all. We are currently experiencing a shared trauma. All of us together are experiencing this, and it's bringing about some very stressful and in some cases devastating outcomes for all of us. So we do want to start off by validating that, and we will continue to echo that throughout this presentation. We also want to be coming from this perspective of the yes and mentality. So first of all, yes, validating all that is COVID-19 and everything that comes along with it, while also acknowledging that there were general life stressors happening before COVID, during COVID, and will exist after COVID. So we want to be taking account for all of those factors. We also want to be thinking about the fact that a lot of our caregivers and children have traumatic stress symptoms already, have trauma histories of their own, and those things are also coloring their picture and their experience of COVID-19. So really normalizing the fact that we don't always have the privilege of compartmentalizing or cutting off one thing to focus on another thing. In fact, this is actually a compilation of all of these factors, and that's what's really contributing to our caregiver stress levels right now.
Yeah, and if we start to also really think about how prior to COVID-19, we had all of these other identities and roles and stressors, as Kiera mentioned. And with COVID-19, this is really impacting caregivers in a very unique way. because it's directly disrupting a lot of these support systems that caregivers have had access to some degree in the past. But right now it's looking very different. So we just heard about schools closing for the rest of the semester here in Missouri, which of course means that kiddos are at home full time with caregivers. It might mean that we are not able to see family and friends who maybe provided some respite and extra support for caregivers. We might not have the same type of access to other partners, daycare, social service systems, therapists, partners. Really, even just being able to go to work is much more complicated now because of COVID. And so all of these support systems, though they're not entirely gone, they look very, very different now. And so that's an additional stress that caregivers are having to deal with and having to navigate, because it's really up to them now to remain connected to these support systems. So we really are going to want to focus on that today.
Yeah, and so we do want to try to jump in and start thinking about, while we are considering all of these moving parts, how do we then sort of get some more concrete ways of approaching and targeting our caregiver stress levels? And so step one here is going to be self-awareness. And so self-awareness is really us being intentional about really acknowledging our thoughts and our feelings, our bodily sensations, and what is happening for us in the present moment. So in the here and now. And oftentimes we hear about this reference in the mindfulness literature and the research on mindfulness, and how that is such a beneficial and useful skill for us all. And so we want to talk a little bit about what self-awareness is not. So we are not talking about you drawing attention to what's happening for you and then going into labeling or self-critique or judgmental of or being judgmental of yourself. So you're not saying, because I'm experiencing these feelings, I am then a bad person, I am then a bad parent. You're simply just acknowledging, hey, this is what's happening for me right now at this moment. So you're simply observing. This is also not a time where you're jumping into problem solving, or you're really trying to seek out those solutions to remedy whatever it is that you're experiencing at this present moment. So step one here is going to be really trying to engage in self-awareness. And so we're going to talk more about some tools for kind of kickstarting that process. There are a lot of tools out here that help you gain more insight and help you be more introspective. And so we really wanted to seek out resources that would be very accessible to anyone and everyone. And so we have some free resources that are online, very accessible via Google. And these are also some staples in our practice at the CAC that we use on a daily basis to assist our children and caregivers impacted by trauma. And so our first tool is going to be the feelings wheel. We absolutely love this tool. There are a lot of feelings charts out there, but this one is very special because it starts off with those very basic emotions that a lot of us are familiar with and that a lot of us feel. And then we notice that there's this branching out that happens on the wheel. So the wheel sort of demonstrates for you that this emotion may be stemming from this emotion, which then may be impacting this emotion. Because we know that our emotional processes are very complex, and oftentimes we're not just experiencing one emotion. We're usually experiencing a combination of those things. The feelings wheel also helps us increase our emotional vocabulary. So now we're getting into the practice of actually labeling emotions for ourselves and really pondering about what makes this feeling different from the next feeling. And so, like I said, this is really just going to be a tool for you to kickstart that process of becoming more self-aware. An additional resource that we have here is kind of coming from another angle. So we talked about emotional processes and labeling that, but we also know that we have bodily sensations that happen for us. We have physical experiences that are then impacted by our emotional responses. And so there's been research done that actually highlights and identifies for us, where in my body am I experiencing a certain sensation and what feeling might that be linked to. Once again, there are variations of this. You can find a lot of different types of charts that kind of have this same ideology, and they are also very accessible to you via the internet, and there's a lot of research to back it up. So once again, this is another opportunity to really just try to become self-aware and trying to understand what's happening for you in the present moment.
Yeah, and so when we really focus on becoming self-aware, for a lot of us, it's actually pretty hard to do that in a way that isn't self-judgmental and self-critiquing. A lot of us, when we become aware of the fact that we're having an emotional or a physical response to stress or trauma, start to criticize that and say things to ourselves like, I shouldn't be feeling this way. If I were stronger, I would be feeling this way. I am weak for feeling this way. So all of these kind of harsh words that we use for ourselves sometimes happen when we become self-aware. So our second step is really focusing on how do we build up self-compassion for ourselves? How do we allow for self-compassion to allow us to be self-aware without that judgment in place? Self-compassion really is a practice in which we learn how to be a good friend to ourselves when we need it most and really become an inner ally rather than an inner enemy. And at the heart of this, we're really just talking about how do we learn to be kind to ourselves, which is oftentimes something that we don't learn as children and we really don't talk about as adults. But going back to the basics of it's okay for me to have an emotional response. It's okay for me to be experiencing this in this way. And how do I offer myself some self-compassion and some kindness so that I don't make it that much harder? Because that's what happens when we really start to be down on ourselves. So I really want to walk through some concrete steps that we can take in approaching self-compassion because it is kind of this big topic. So I'm going to be pulling a lot from the work of Dr. Kristin Neff around mindful self-compassion. So for a caregiver, what might this look like? Oftentimes, caregivers, we might be in a situation where we feel really overwhelmed. So some of the internal dialogue that we feel or hear in our heads sounds something like this. Wow, I really can't get anything done right anymore. Everyone else is doing so much better than me. My kids must hate me. I feel frustrated. Everyone's just unhappy. It's all my fault. So if we're going to take an approach of self-compassion, what we could do is first observe and become self-aware, like Kiera was talking about. So saying to ourselves, I'm noticing that I'm using some pretty harsh words to describe myself right now, and it's actually making me feel more upset. So just stating what it is that's happening. The second step would be to really try to connect to the common human experience of what we're going through. So I am sure that other parents are also feeling really overwhelmed right now. My friend called me yesterday and told me that she was also feeling really overwhelmed right now. So really trying to understand that you are not alone in this feeling and in this situation, that there are other people who have also felt the same way. And then that last piece would be when we insert that self-kindness. So really truly actually using kindness words to ourselves, saying things like, I'm trying my best right now. I can try again tomorrow. I'm not perfect, but I'm continuing to try, and that's good enough. So just really trying to break down those steps of self-compassion of first becoming aware of what we're doing, second, trying to connect our experience to the rest of humanity and know that we're not alone in it. And lastly, really share and extend some kindness to ourselves. So we can go on and really want to actually practice this in real time with you all because Kiera and I really believe that, it's not enough to just talk about these things, but really trying to get into a place where we can practice them. So on the screen right now, you'll see what I call a self-compassion mantra. And so if you are in a place or in a time where you feel comfortable doing this with me, just go ahead and sit back. Maybe you can place a hand gently over your heart or over your chest, any position that really makes you feel comfortable and self-soothed. And then just repeat the words after me. So this is a moment of suffering. This hurts. I am not alone in this. Struggling is a part of life. Others have felt how I am feeling now. May I give myself the compassion I need. May I be kind. May I be patient. May I be strong. May I receive love and kindness. So using something as effective and also as simple as a mantra like this can really just extend to us some of that self-soothing that will in turn allow us to really kind of have some forward motion, to not get stuck in that self-critique and in those emotions. So we really wanted to give you kind of this foundation of how do we approach a situation. So first of all, becoming self-aware. Second of all, really extending self-compassion to ourselves. The remainder of today's talk, we really want to focus on some concrete caregiving strategies that you can utilize at home with your kids right now. So like I said, Really, it's important for us first to look at ourselves. And this is because caregivers need to be able to self-regulate before they're able to effectively do that with their child or whoever they're caregiving for. Research shows us that caregiver stress levels directly impact their interactions with their children, as well as their child's functioning. So it's definitely something that we need to target if we're wanting to address that situation. Something that's really easy to remember is when if anybody who's ever flown, at the very beginning of that flight, they always say some kind of speech around safety. And one of the pieces is, if we should lose air pressure in the cabin, oxygen masks will fall down. Adults, please put on your own oxygen mask before helping others. This is the exact same idea, is how do we make sure that we as caregivers are regulated before moving on to assisting others? And so that's what we're going to focus on in this section about self-regulation skills. One of the things that we want to look at is really the idea of not all of these skills will work for everybody at every time. And so again, being self-compassionate as you try these and have a trial and error period. But really more importantly than that, realizing that these specific strategies target different emotional and physical reactions that we have to stress. So it's not like we can use one coping skill that will, catch all and fix everything. It's not like doing yoga will all of a sudden fix all the different responses that we're having. There are specific techniques for different things. So a couple of the main things that we look at when we're looking at people who are experiencing chronic stress or high levels of stress is that they might have their mood impacted. So they might start to feel depressed or anxious. And so we have specific techniques for that. Things like distraction techniques, activation skills, so getting up and moving to kind of get your blood flowing, and doing a lot of the self-soothing skills that we kind of talked about earlier with self-compassion. Another big impact area is physiological distress. So these are the body sensations that Kiara was talking about. The idea of when we're in chronic stress, we might start to really feel that in our bodies. And this can be in big ways and in ways that sometimes we don't even notice. So it could be really intense stomach aches or chronic headaches or really fast heartbeats, things like this that we notice in our bodies. And the last piece is that behavioral dysregulation. So behaving in ways that feel out of control. And we see this a lot in children who don't yet have the skills to navigate an intense emotional response. Today, I also want to try out a couple of different techniques that you guys can use at home, two that we use often in our agency because we find them to be really effective. So one of them, we call it our Take 5 technique. And this is, if we can just go back. Thank you. We call it our Take 5 technique, and it's actually used to address our physiological distress. So sometimes when we're really, really stressed out, we feel that our mind starts to go elsewhere, or we kind of just check out, or we just feel out of it, that experience. The Take 5 technique is a grounding tool that allows us to come back into ourselves and feel grounded to that moment. So what we're doing is that we're using our 5 senses. So we're using our hearing, our seeing, our smelling, our tasting, and our touching, right? Using these 5 senses to ground ourselves. And this is really applicable to little kiddos all the way up into adulthood. And so what we would do is that you would pick one of those senses and really try to focus all of your attention into that to try to bring yourself back down. So for example, maybe if I'm in a situation where I really can't get up and move, I'm going to focus on my sight and say to myself, okay, Ale, find 5 yellow things in this room. So focusing that attention on something very specific and very concrete in my environment. So getting kind of outside of myself to bring myself in. That Take 5 technique, you would just apply that to every single sense until you feel really grounded in the moment. The other technique that I really want to talk about is deep breathing, or what we call for our little kiddos belly breathing. The idea of learning how to control our breath to kind of reduce anxiety, stress, distress in general. Because what we notice is that oftentimes when we're feeling these kind of really intense emotions, sometimes our hearts will start to beat really fast and our palms will get sweaty. These are physical reactions that we typically don't have any control over as far as thoughts go. So I can't think to myself, heart, stop beating this fast. Heart, slow down, because my heart's going to do what my heart's going to do. However, if we target our breathing, we are able to target some of these other physical responses. So if I'm able to slow down my breathing, I'm able to slow down how fast my heart is beating. So again, we're going to try something out together, everyone who feels comfortable. Why don't we go ahead and place one hand over our chest, one hand over our belly. The idea with belly breathing is that we're going to take a long and slow measured breath all the way down into our belly so that our hand on our belly rises up further than our hand on our chest, okay? So we'll start with 1, 2, 3, 4, and exhale. We'll try that one more time. Slow. 1, 2, 3, 4. So doing these kinds of breathing techniques can really help us feel more connected to ourselves and really can help slow down everything that's going on in our bodies. And it's something that we can use with young kids and adults, and it works equally the same. Oftentimes when I tell a family for the first time about breathing techniques and I tell them to take a deep breath, this is what I get. So just as a reference point, that is not what we're trying to do, because right then the air just stayed up here. We're trying to get it all the way down, nice and slow. But that's kind of the general idea. So I wanted to give those little tidbits of strategies that you could try at home. Now that we know that there are lots of different things that we can use at once, not at once, at different points of our distress, I want to talk about how do we actually know which strategy to use and when. So something that I want to introduce is the feelings thermometer. And that is something that we use on the daily at our agency. It's a really great way to just do a check-in with yourself. So a feelings thermometer is really just a way to gauge where we're at in our own emotional response. And the goal is to be right in that just right comfortable position, that Goldilocks of in the middle, not too hot, not too cold. When we're at that very hot level, we're very uncomfortable, very distressed, very anxious. Our urge is to get out and run, get out of there, that fight response, right? The opposite end of that is being ice cold. So being totally bored, disengaged, not focused, basically not wanting to engage in whatever it is that you're doing. And so really we want to work to keep ourselves in that middle spot. And so when you're noticing that you're at a very high level, using coping skills that will address you there, and noticing when you're kind of on a lower, maybe you'll use some activation things that will get you right into the middle. That's the sweet spot where you can really do some really powerful co-regulation skills, which Kiara will now talk about.
Yeah, so Alejandra mentioned some ways that as caregivers, you all can be focusing on regulating yourselves and how important it is that you've laid a foundation to where you do have some skills ready to be able to focus on self-regulation. So now we're going to move on to sort of the next level of that, which includes in actually engaging your kiddo or this person that you're in the caring position for. And so to talk more about co-regulation strategies, we are actually going to be talking about how to start off internally as caregivers. So we talk a lot about this idea of the thermostat versus the thermometer. So when you think about what a thermometer's job is to simply mimic and mirror whatever the temperature is in the room. That's the data that is giving you, hey, this is how it feels in the room right now. Whereas a thermostat is actually going to set the tone for how things are going to go in the room. So as caregivers, it's on you to really try to set that tone, to sort of send these clear messages that, hey, this is going to be a safe situation. This is not going to be an escalating situation. And so you want to also be able to assess where your kiddo is right now. So Alejandra mentioned the feelings thermometer and how it can be useful for us to use that to assess our own dysregulation. But there's also some opportunity there to try to make some guesses at where your child's feeling thermometer may be and what strategies they may need to help them calm down. So that's that internal work that we're doing while we're trying to focus on engaging our kiddos. Now, what that looks like externally is us really sending some nonverbal cues that do not signal a threat, right? So when we talk about children who are very stressed, or especially talk about children who have trauma histories, we want to make sure that that fight, flight, freeze response is not being activated even more. So there are some ways that we can do that. So trying to make sure that we are eye level to our kiddos and that we're not towering over them. We're not using our power stance. So we're not arms crossed, arms on our hips. We're actually displaying a very open and calm posture with them. And these are just nonverbal cues. This is communication communication prior to us even opening our mouths. Now, when we do actually speak, we want to make sure that we're at a place where we can speak to our kiddos in a low and calm tone of voice. Once again, we want to send very clear messages of de-escalation. And then we also want to be demonstrating empathy while also not showing some threatening or activating facial cues. So look like you care without also signaling some anger, or things that may really set your kiddo off. So those are some tips as far as when they go high, we go low as the caregivers, because we're going to set that tone for a low level situation. Now, once we talk about actually trying to engage in some conversation with our kiddos, we want to make sure that first they are in a calmer state, so their feelings thermometer is low enough to be able to engage in some dialogue. And so once you've gotten the feel that they're in that place, we like to use what we reference like a narration or even like some self-disclosure to really try to help our kiddos utilize those skills of emotional labeling, increasing their self-awareness as far as how their bodies are currently responding to stress. And so those are going to be those ways that we get them to tune in to what's happening for them. So we then can start focusing on what do you need in order to feel more calm and in order to feel more safe. So the way that narration process can look, right? So if we have kids who are in a very dysregulated state, they may shut down or they may be in their fight mode or in their defensive mode. And so you can narrate for them when they don't exactly have the tools to articulate it for themselves. You can say things like, hey, I'm noticing that you have a frown face and you're not showing me much eye contact. Maybe you're feeling angry right now. So remember, we're throwing out that maybe very purposefully, because our kiddos don't like to be told what they're feeling or what's happening for them right now. The goal here is really to just start drawing some attention to what's happening in the here and now. This is what I'm seeing. What do you think is happening for you? Now, another way to go about this could be in self-disclosure. So us as the caregivers normalizing that we too feel upset and our bodies too respond to that stress. And so that may look like, so when my shoulders start to rise and I feel my hands fisted up, I know that I'm feeling angry. Might that be what's happening for you right now? So once again, we're leaving it very open and we're really just encouraging that dialogue around what's happening in the present moment. And that goes back to this idea of self-awareness. Now that we as the caregivers have utilized that as a self-regulation strategy, we also want to help our kiddos adopt a similar way of processing their concerns. And so something that we want you to remember, hold in mind that we started off talking about this yes and mentality. So we started off really trying to validate that there's all of this stuff happening at the exact same time. So in no way are we saying that you should immediately be able to tackle each and everything. In no way are we encouraging you to aim for perfection. It really is in the effort. It really is in that desire to want to improve and to want to understand yourself and your kiddo better. That's where the real work is, and that's where we're going to see some real positive change. And so everything that me and Alejandra have mentioned thus far have been things that we encourage you to practice, things that we encourage you to try out. And so we do want to send a very clear message to our caregivers that this is a very tough time for us all, and maybe an even tougher time based on you and your specific context. And so we really want you to practice that idea of self-compassion during this time. So even if you try out these strategies and you find that they're not working as well for you or they're not working out as well for your kiddos, be sure to remain compassionate towards yourself. Watch how you're talking to yourself. Try to avoid that judgmental tone and really just bask in the fact that you're here, you're putting in the effort, and that you will continue to do so. And so we do want to send out some warm and well wishes to you all. Keep moving forward. And yeah, we were happy to be here and to be able to share this moment with you.
Wonderful. Well, thank you so very much for all this great information.
Thank you.
fantastic as we think about how we can support ourselves, and just that gentle reminder of we need to be kind and compassionate with ourselves, given all the responsibilities, the weight, the anxiety, the stress, all the sense of overwhelm we may be feeling at once. And so thank you so much for the reminder, and also for the great tools that you shared with us today. I wanted to just really quickly ask you, you talked a lot about the self-compassion, and sometimes, as caregivers, we're taught that I'm the last person that I need to worry about. I have so many other responsibilities. And so I know starting on that journey of self-compassion can sometimes be tricky, especially when we've received all of these messages, whether they be from our family of origin, whether they be from, maybe cultural or gendered messages. How is it that you may encourage a caregiver to initially engage in this process of self-compassion during this time?
Yeah, that's a great question, Sean, because I think that there are a lot of beliefs around what self-compassion really is, or what it would mean for you. So it would mean that you're being selfish, or that you're just going to treat yourself all the time, or that you're going to let yourself off the hook, and that these would be really dangerous because you're the one that's responsible for your family and for your kiddos. But really, what I would say to those caregivers who are struggling with the idea of self-compassion and being kind to themselves is that self-compassion is the exact same way that we encourage everybody to treat others. So if we're going to treat others with love and kindness and respect, really trying to just turn that inward, and knowing that that's just going to make us a stronger, better, more resilient person, a happier person with lower anxiety and lower depression. And that in turn will help us be stronger caregivers, a stronger friend, a stronger partner, a stronger relative. So it really is kind of this beautiful circle of, if we put out something and also put it in, it just continues to flow.
And on that note as well, thinking about specific exercises that we often do in our practice, one of them is, what would you say to your best friend who was in your shoes? So oftentimes it's easier for us to sort of click into that mode because we're caregivers and we are used to kind of putting out that love and that energy. And so it could be easier for you to try to replace yourself with a best friend. Well, what would I say to that best friend? And then trying to bring that more to an internal space. So that may be a good place to start as well.
Wonderful. Well, thank you too for all of that great information you shared. And for those of you tuning in live or tuning in after the fact, your daily challenge today is going to be, show yourself some self-compassion. Give yourself permission and understand that this is a difficult time. And so how is it that you lovingly take care of yourself, as Kiara mentioned, just as you would a best friend, but making sure that you are showing yourself first and foremost that compassion. So I want to say a very special thank you to you two for sharing all of this great information, and for really helping us to honor what our caregivers are going through in this time, recognizing that they too need some special support and that dose of support during this time. Now, as we end our episode today, we are starting our hashtag Celebrating Essential. And this week, what we really want to work on doing is celebrating those essential people out there who are working to create an alive and well community during this stressful time. And we know that those essential folks are in all different industries, whether it be in healthcare, whether it be in food service right now, that so many people are working to keep our communities alive and well. And we want to take time to honor them. And we're going to honor an individual or group each and every single day this week, and hopefully moving forward. So today's celebrating essential person that we want to honor is Kristin Simpson. And Kristin is a nurse practitioner at Washington University, and she's an inpatient nurse practitioner in the Division of Hematology. And during this time, she's continuing to go to work every single day to help really provide inpatient treatment and management of acute and chronic illness, specifically working with patients that live with sickle cell anemia. We know that during this time, we know that illness still happens, and that for those living with sickle cell anemia, they may still face those stressors, those attacks. And so making sure that all of our community is well cared for, especially those living with chronic illness. So Kristin, thank you so much for what you do to keep our community alive and well. Thank you for taking excellent care of our patients. And again, if you have someone you want to recommend this week for Celebrating Essential, please send us a message or email us at info@awcommunities.org, because we know that all of our essential employees deserve to be celebrated during this time. So again, special thanks to Alejandra and Kiera. And for those of you tuning in, we'll see you back here tomorrow for another episode of The Daily Dose. Bye.